We got a 6-year-old established patient. Parents, our historian. He's 5-year-old male with cough and wheeze times a week. The history is from his dad. Our history of present illness. He has a non-productive cough, wheezing. Occasionally, the cough is worse at bedtime and is not improved with over-the-counter drug medications, cough medications. He's had occasional vomiting and intermittent fevers up to 102. He has no history of asthma. There's no family history of asthma or recurrent respiratory infections. Review of systems. We don't have anything significant here. We have a temp. The patient, general physical exam. The patient is awake, alert. Tympanic membranes are normal. I'm looking at everything here and making sure there's nothing that jumps out that might not be applicable to this exam, just in case he brings up another diagnosis. I have an assessment of pneumonia. In the lungs, he noted rhonchi throughout both lung fields. He's going to give this child Zithromax, 200 milligrams. Continue the Mucinex, Motrin as needed every 6 hours for his fever. And he tells the dad to follow up in a week or sooner if the symptoms get worse. Let's go look at our walkthrough. We got one diagnosis. J18.9. We don't know what type. There was no culture done to maybe identify a bacteria. We just know we have pneumonia. Let's look at our E&M because there was nothing else done. We have an acute illness with systemic symptoms. We got fever and all that going on. In your E&M guidelines, make a note of what systemic symptoms are. That will help. Which we all got this, but I still, for future reference, I want you to focus in on what certain things mean. These definitions are critical. We have an assessment requiring the dad, so we have a low level. And then, of course, we had the antibiotic, so we have a moderate level, 99214. Questions?
Yes, I just want to confirm this also. What, apart from fever, what other examples of systemic symptoms do we have?
I want to pull that up. It's a good question. I'm just hoping I can get it to show me. Because I want it to show, I want you to see for systemic general symptoms, fever, body aches, fatigue. So this gives us an example. But if you do a search, then you want to go through each and every term. I do that a lot to find out answers to questions just like you just asked. As I was learning E&M, I needed to know what the American Medical Association considered systemic symptoms. So that is a very good question, and they've covered it very well in their guidelines. So if you pull this up, you know, some things are not significant. It's not what you're looking for. But the main thing is that you understand, and then, so that's a good question, that we can understand what we're looking for with systemic symptoms. So you know, here, systemic symptoms may not be general, but may be a single system, such as the pneumonitis or the colitis, because that's an infection running. And with those infections, you're going to have that fever and you're going to have the body aches. Go back and look at your guidelines, read them. Don't just look at them.